So recording is on. So now I am sharing my screen. Dr. Naseemul Huda, are you able to see my screen?
Yes, yes.
Okay. So basically, as I mentioned that the history taking the station 2 is one of the easiest task which appears so easiest and so easy to all of the candidates, but it is also a difficult in a sense that station 2 has the highest failure rate. So today we will discuss how to take a adequate history, how to follow some pattern and how to reach the diagnosis. I am basically giving you a you can say a roadmap or a skeleton of history taking. So you can take the notes while going through this presentation. And I want my all the July group candidates to please apply it in the coming scenarios. Dr. Naseem, am I clear to all of you?
Yes, yes, doctor.
Okay. So first of all, when you are entering in the station 2, you will be given a scenario outside and you will have 5 minutes to read this scenario. They will provide you some information, some past history, and some maybe some medical data. And what you're gonna do is that you will take the notes, you will write down the patient name, patient age, and the summary of the case on your paper, on your blank paper. Now, after that, you will list out the differentials while sitting outside. Suppose you are getting a patient with a headache and hypertension. You can put a long list of differential, even pheochromocytoma can come, even hypertension induced headache can come in this case, and even anxiety can come in this state. So you will write down all the possible diagnosis, all the list of possible differentials on the paper. And you should have command on your case, and you should know that what information has been provided to you while you are sitting outside of the station 2. So try to collaborate all the findings and try to open your mind and see the patient age, available data, past history, presentation. So after collaborating all the given data, you will come up with some differentials. There can be 5 differentials, 6 differentials, 8 differentials, 10 differentials. Write them all on the paper. Okay? But to see my voice is clear, please be
Yes,
in touch
doctor.
with me.
Yes, yes, clear.
And once you have written all the differentials on your paper, you will enter in the examination hall of station 2. You will be greeted by 2 examiners. They will provide you a chair and there will be a surrogate in front of you. You will say, hello, hello. My name is Dr. Ahsam, one of the doctor in the clinic today. Am I speaking to Mr. Naseem, 34 years old? Yes. Sir, I has been asked to take your medical history, and while this taking this medical history, I will like to take few notes. And I assure you that these notes will stay confidential with me, and my attention will be towards you throughout. You will say this, you will obtain the consent, then you will ask simply, sir, what brought you over here? So he will listen to him. This is a golden silence period. Golden silence period. Listen to him. He will tell you some stuff. Doctor, I am having loose motions. I am having weight loss, blind. I am having all this stuff for the last 3 months. And I visited this doctor, and they have done endoscopy on me. If he is speaking for 1 or 2 minutes, no problem. Let him speak. Try to gather the data. Mostly they will finish the narration in 15 to 30 seconds. After that, now you have the complaint. You have the complaint of either loose motions or any other complaint, but I will divide each complaint into two parts, complaints into two. One is the complaint of pain, any sort of pain, abdominal pain, headache, bone pain, eye pain, any pain. And second, any other complaint except pain. So in the station 2, you will have two types of complaints. One, pain, any type of pain, and second, any other complaints. Say, for example, loose motion. Say, for example, shortness of breath. Say, for example, cough. Okay, Dr. Naseem, am I clear?
Yes.
Okay. So what you're gonna do is that if you are dealing with any complaint which is not pain, do OD para, OD para, OD para of that complaint. What is OD para? O for onset, D for duration, P for progression, A for associated symptoms, R for relieving factors, A for aggravating factors. Say, for example, patient is saying to me that I am having SOB, shortness of breath. I will ask, how did it started? Sudden or gradual? This is onset. D, for how long, sir, you are having this shortness of breath? This is duration. P, progression. Sir, is it getting progressive since 3 months? Or it's the same intensity, or it is having the same intensity like it was 3 months back? Okay, clear? And
Yes,
then,
doctor.
yes, okay, thank you. And then you will ask any associated symptoms. What can be the associated symptom of the shortness of breath? It can be cough, it can be sputum, it can be chest pain, it can be anything which you can think that it can be linked or associated to shortness of breath. Sorry. Then coming to relieving factor, what improves your shortness of breath? Doctor, when I take inhaler, it improves my shortness of breath. Doctor, when I'm taking rest, it improves my shortness of breath. Doctor, when I am walking, it improves my shortness of breath. So you have to inquire about the factors which are relieving this problem, which is making it better. And then of course, the aggravating factors. Doctor, when I am lying down in the bed, it get worsen. When I am walking, it get worsen. When I am, say, for example, doing anything, it get worsen. When I'm taking this drug, it get worsen. So you need to evaluate OD para. Is it clear?
Yes.
Okay. Now, say, for example, your second, now I'm coming to the second part, that is pain, which is Socrates. Socrates, which is for pain, any sort of pain of MI, pain of eye, pain of head, pain of foot, pain of chest, pain of abdomen. So, what is Socrates? S for sight, O for onset, C for character. How you will ask the patient about the character? Patient will not tell you, sir, what's the character of your pain? He is not a medical person. He may be a vendor, fruit vendor, or he may be a person who is not educated. So you will ask, sir, how it feels like, how it feels like to you. Even if he is still confused, you can ask, sir, uh, how it feels like, is it dull, is it sharp, is it stabbing, is it boring? Okay. And then of course you will ask about, is this pain going to any site? Simply ask this, is this pain going to any site? So he will tell you, yeah doctor, it's going to back, or it's going upward, it's going downward. And then of course associated symptoms. Now what are the associated symptom of your pain? Now again, it's your intelligence, it's depend upon the part involved, or the area involved in which the patient is complaining of the pain. So it can be, if it is you are evaluating the pain of the eye, of course you will ask about diplopia, of course you will ask about redness of the eyes, of course you will ask about itching or watering of the eyes. But if it is the tummy pain, of course, you will ask about nausea, you will ask about vomiting, you will ask about loose motions, you will ask about constipation. So it depends on the system, or the relevant area which you are exploring. Okay. And then the timing, of course, timing is extremely important. Dr. Nsimuda, are you with me?
Yes.
So in the timing, of course, you know that the headache of OSA, the OSA headache is more in the morning. The headache of raised ICP is more in the morning. Asthmatics attack are mostly they have the diurnal variation. So timing is extremely important when you are evaluating, especially the pain and alleviating factors. E mean alleviating factors and the aggravating factors, and S mean the severity of this pain. Severity of this pain. So what I mean by severity, tell to your surrogate that sir, 1 being so mild and 10 being so severe, how will you grade your pain? Simple as that. But you need to tell that 1 is mild and 10 is severe. Now, say for example, you are getting a picture after Odipara and after Socrates, you are getting some picture. You are making some mind that my case is going toward this system or my case is going toward this diagnosis. Evaluate it more. You can ask some questions like some sporting questions. Say, for example, patient is having pain in the leg, and you came to know that this is cellulitis. You can ask any skin changes, any redness, any swelling over there, any fevers. So you need to evaluate it more, and evaluate it more is a box, and you should evaluate your complaint after completing OD para and Socrates. So we had divided complaints into two. One is the pain, other is the non-pain complaints. But there are few other complaints which are bit different. Say for example, loss of consciousness. Say for example, history of fits. So these complaints are bit tricky, and we will surely discuss them in some other session, like how you will proceed with a patient having loss of consciousness or fits. So basically, I will tell you over here very shortly that in such complaints, what we do is that we'll ask some specific questions. And there are, I think, mostly more or less 2 or 3 complaints which need a specific questions, which are not getting fit into OD para or Socrates. One is the fits and other is the loss of consciousness. Like what you were doing before that, what exactly you were performing at that time, any symptoms then, any warning signs then, what happened exactly when you had lost your consciousness. So he will tell you, I was reading newspaper, or I was getting from sitting from the I was standing from the sitting posture, like I just used a toilet seat and I was standing from the sitting posture. Or he can tell you that I was running after the bus. I lost my consciousness. It can be the case of hokum. It can be the case of aortic stenosis. So ask what you were doing. He will tell you, even if you are evaluating such complaints in station 5. And then during that loss of consciousness, what happened? He will not be able to tell you, but he will tell you that my mom or my dad or my friends were seeing that my body was jerking, okay, or I was having some unconsciousness, or I fell to ground. So you will ask this, and you can ask some other question like any incontinence of the bowels or waterworks, or any injury when you fell to ground, or any specific types of jerks in the body. And after that, when you regain the consciousness, who bring you over here in our ER? How you went over here, like by your own or by some other means, like he was still it means that the loss of consciousness was for the long duration. Usually in the cardiac issues it's only just for 2 to 3 minutes, but if it is a long duration, you can think about the neurological deficit. So you should ask, and when you regain the consciousness, were you confused or were you fully stable? So this is one complaint, that is loss of consciousness, fits. Otherwise, almost, I am not saying all the complaints, but almost many complaints get fit in the model of OD para and Socrates. Okay?
Okay.
Dr. Naseem, my voice is clear?
Yes.
That's great. Okay, so you had just evaluated the presenting complete. Now, after that, first step, what you will do? First step, very first step, see which system is involved, which system. Pick the system. Suppose the patient is having loose motion, it is linked to your GI. Suppose the patient is having numbness, it is linked to CNS. Suppose the patient is having racing and pacing of heart, it is linked to CVS. So evaluate that system intensely, deeply. Ask all the question of that system over here. Loose motions, now ask the vomiting, now ask feeling sick, now ask jaundice, now ask abdominal pain, now ask hematemesis, now ask melena, now ask everything. Here you will try to open up that associated system. You will intensely ask all the questions pertaining to that system. Okay, is it clear?
Yes.
Okay, that's great. Thank you, Dr. Naseem. So basically, first step, you did complaint OD para or SOC rates. Then you evaluated that complaint bit. Then you had open up that system, and you are now asking all the question linked to CVS if it was a racing and pacing of heart. Okay. Now, now the next uh, slide is about the general questions. You should memorize these questions. These are extremely high yield questions, and often your diagnosis is somewhere is made somewhere within these questions, because these are the questions. If you look very carefully this slide, Dr. Nasima, why my slide is clear?
Yes. Yes. Clear, doctor.
So if you see that lot of the diagnoses are written over here, like SLE, like PBC, like PSC, like any joint problems, any connective tissue diseases, thyroid problems, infections, all almost I think 50% diagnoses are hidden in this slide. This is extremely high yield slide. Read very carefully. All the questions are mentioned over here. So I had classified them under the general questions. So I think there are maybe 8 or 9 questions, so you can memorize them. Don't miss even a single question out of 10, because it will make your diagnosis. It will ease you in making a diagnosis. It will rule out your other differentials. So after digging out your active complaint, after digging out the relevant system, then you will ask these questions, and they are I think 8 to 10 questions, and it's not difficult to memorize or cram these questions. That do you feel any fatigue, any changes in your weight, do you have any excess sweating, any increased body temperatures, joint pains? So you should ask these questions under this heading now. Okay, Dr. Naseem, am
Yes.
I clear to everyone?
Yes, doctor.
Okay, thank
It's
you.
clear.
So now you had asked your all the questions which are the general questions. First, active complaint, then associated system, then general questions, which are 8 to 10 questions. Now you are broughting up your paper. Which paper? Which you had written outside of your examination hall, when you were given 5 minutes outside your hall, your station 2. Now you have written 5 to 6 differentials over here available to you after you had read the scenario outside. Now paper is in front of you. You will see that if you are following my scheme, if you are following this scheme, my presentation, you will feel that almost 70% differentials will be ruled out till here. You will start cutting all the differentials. If you have written 10 differentials after taking the history which I had taught you will feel that 60 to 70% differentials will get cancelled by you in that point. Now maybe 3 or 4 differentials will be left. You can ask open-ended questions about those differentials over here. Okay, so now you are completing your workup. You are making a diagnosis. Now you are giving a shape to your station 2. So, say for example, you have written some 6 differentials outside. 4 has been ruled out after asking any sweating, after asking any fevers, after asking any weight changes. See, if there is no weight changes, usually cancers are ruled out. If there are no fevers, usually infections are ruled out. If there is no sweating, usually thyroid problems are ruled out. If there is no rash or any no joint pain, mixed connective tissues are ruled out. So you are ruling out. You are ruling out. But maybe 1 or 2 differentials are left. You can ask open-ended questions about them. Now, till here, till this slide, what I want from you, from my all candidates, is that your differentials or your diagnosis should be finalized. At least 2 or 3 differentials should be in your mind till here. Now, after that, you should have a command on your case. You should tell to your examiner that I am having full command on my case and I know where this case is going. After that, you will ask the past history. In the past history, you need few questions. Sir, has you been diagnosed by any condition in the past? Yes, doctor, I'm having diabetes. Yes, doctor, I'm tuberculosis. Yes, doctor, I'm having hypertension. How well they are controlled? If no, sir, why they are not controlled? Are you taking prescribed medicines regularly? He will tell you. And after that, ask about any surgical, medical, dental procedures, or any previous hospitalization, including blood transfusion. Now, say for example, I am having the patient with GBS in my station 2. Now, if I am not asking him whether you were hospitalized before or not, how I will make that diagnosis of GBS? He will tell me that, doctor, 15 days back, I was admitted in the hospital with loose motions. Say, for example, the patient is having a Reiter's syndrome or reactive arthritis. He will tell me, yeah, doctor, I was having bloody loose motions about 15 days back. So don't just, fulfill the convention. Rather, try to dig out. Like, if you were admitted in the hospital 15 days back, what was the diagnosis? If he is not telling you diagnosis, no problem. Ask him which medications were given to you. Any discharge advice was provided to you. Then, of course, surgical and medical procedures, including endoscopies, colonoscopies, ERCPs, or any other procedures which are relevant to your case should be asked. And dental procedures are important for endocarditis or infections like hepatitis B and C and blood transfusions. After that, now there is a mnemonic. The mnemonic is PALM. PALM. P for past history, A for allergies, M for medicine histories. PALM, PALM, PALM. So P for past history, A for allergies. Sir, do you have any food or medication allergies? If we say no, it's okay. If we say yes, ask which medications. But in the case of asthma, you must ask any dust allergies, any pollen allergies, any house dust mite allergies, any other allergies. So, in the asthma, you should also ask in detail to tell to your examiner that I am thinking about asthma. So, if your patient is saying that I am allergic to penicillin, say it's okay, we will avoid and I will mention it in your notes. So PALM, we are doing PALM, P for past history, A for allergies, and M for medication history, medication history, medication history. Now this slide, which I had just opened it, it's extremely important slide, extremely important slide. Dr. Naseem,
Yes.
why
Yes.
this is
Yes.
slide
Clear.
is clear or
Yes.
it's small? What about font?
No. 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 It's okay.
Okay,
It's
okay. So what I feel during my course of July, lot of candidates overlook this portion of the history. They just take this history as a formality. And in my course, I'm also warning my candidates that you will get a lot of diagnosis hidden over here. So please try to dig it out. See how you will take. First of all, simply tell to your surrogate, can you please show me your medication list? They usually have the list. They are having the list written on the paper. Okay, so he will show you, and there will be written tablet amlodipine 10 milligram, OD tablet, rosuvastatin 20 milligram, HS. So he will show you, sir, since how long you're taking these, and in which dosage? Maybe he is not taking the appropriate dose. He will tell you, doctor, I am taking these medication for last 1 day, or I am taking these medication for last 10 years. So it's important because the medication which he is taking for the last 10 years may be leading to some grave side effects, or if a medication is started just 1 day back. So it depends on your scenario. After that, you will ask any recent stoppage or change of dosage of any medication. Say, for example, I am giving you example. The patient is having dizziness. Okay, he feels dizzy while he stands from the sitting posture, and he is taking tablet. What I can say, you can say any ARB or any ACE inhibitor for the last 6 months. But for the last 2 months, dosage has been doubled or it has been increased. And since then, he is having dizziness, which is the common side effect of ARBs or ACE inhibitors. So you will, establish a temporal relationship that as this patient had escalated the dose of ARB, he is having dizziness. And sir, this dizziness is attributed to increase in the dosage of ARB. Okay. Now, I don't know whether my patient is compliant with this medication or not. Maybe he is not taking, he is showing me the medication list, and I am putting the side effect of that medication. I'm thinking that this is a side effect of that medication that my patient is having anemia. Say, for example, patient is saying that, sir, patient is showing to you the list that he's taking warfarin, he's taking aspirin, he's taking a lot of medications, and you think that this anemia is secondary to the warfarin or maybe secondary to the aspirin. But you will be surprised when you will come to know that this patient is not even touching the warfarin. He is not taking aspirin. He is showing you the list because this list was provided to him by the doctor, the treating doctor, but he is not compliant. So you should ask whether you are taking or not. He will say, no, doctor, they has been prescribed to me, but I am not taking. So you can ask if they are not compliant, what's the specific reason is, and if you can manage the concern, you can manage. If maybe the patient is saying that I am having some social stigma in taking insulin, or I am having this and this problem, I am not taking beta blocker because of the risk of impotence. So you need to evaluate it and manage it by 1 to 2 sentences. But it's extremely important whether the patient is compliant with the provided list or not. Of course, then we will go, are you tolerating them well? Any side effects? Maybe he's suffering from many side effects. Maybe he is having some side effects and he's unable to explain to you. So try to ask this question also. And of course, you all know that you will ask about any over-the-counter medications and any herbal preparations. Okay, so they are important because herbal preparations leads to sometimes the renal failure, the liver failure, and Also, the over-the-counter medications can lead to um, um, some side effects which you should know, and which can come up in the exam. And sometime, it has happened that the husband was taking the beta blocker of the wife. He was not prescribed by beta blocker by any doctor, but don't know why he was taking the beta blocker of the wife, because he was having anxiety. So secondary to these beta blocker, he was having shortness of breath, bronchospasm. So ask, please ask, which medication he is taking. Even sometime, as I am giving the example that the husband was taking the beta blocker of the wife, they will not be in the medication list. They will not be prescribed to him. But you need to ask which medications you are taking as a whole, out of this medication list and in this medication list. Clear, Dr. Naseem?
Yes. Yeah.
Sorry. Now, coming to the family history. Again, this is very important, and if you are missing the family history, you will lose the marks. Now, see, till here, I had not done any systemic review. I'm sure that you are noting that I had not even started any systemic review. Why? I will tell you the reason. But for now, remember that we had not done any systemic review till now. After that, the family history. There is also a mnemonic, that is FOSS. F for family history, O for ops history, S for sexual history, S for social history. So in the family history, you need to ask any evidence of similar condition in the family. I am having flu, I am having COVID, my wife is also having COVID. I am having sore throat, my wife is also having sore throat. So you can attribute it to some infective etiology. And if he is saying that I live alone, so you can ask any co-workers or any colleagues having similar conditions. It's extremely very important. And then any other disease which run in your family. Say, for example, some congenital problems, some family problems, hypertension, diabetes, or anything like that. Then, of course, you need to ask any sudden cardiac death in your family, and any cancers in your family. Any cancers in your family. Moving ahead, then comes the sexual history. So this is a very sensitive zone. You should first of all give a warning shot to your patient that I gonna take your sexual history, because it is extremely personal. It is the thing which should be asked in a very polite manner, in a non-judgmental way, because there are some different practices than in our Southeast Asia or in our Middle East than the UK. So something is you should be very very conscious while taking this history. First of all, are you in any long-term relationships, any kids, and then any casual partners? You need to ask very politely, sir, I need to ask you a few questions. They are personal, and I assure you that they will be fully confidential. And I do ask these questions to a lot of my patients. Any long-term relationships, any casual partners? If yes, practicing safe sex or not, and if required, you can ask about a sexual orientation. And sexual orientation, of course, if they are homosexual in the sexual practices, or the heterosexual. This is again very important, but ask in extremely non-judgmental way, and try to be empathetic while you're asking this. And if the scenario is linked to some intimate relationship, again you should be very polite. Then, of course, the question of the ops history, and here you have four P's, P P P P. Now, what is this, madam? How are your periods? When you had them last time? To clarify it. So, Ask about the periods. How are they? Are they regular or irregular? Any chances of pregnancy at present? Second P, any complications in the previous pregnancies? Any, are you taking any pills? So you can ask me why I had not taken the history of pills in the medication section, because they don't consider pills as a medications. So contraceptive pills should be asked over here. Maybe a female is taking contraceptive OCPs and you are asking her to please show the medication list, and he has not she has not been prescribed any OCP, but she is taking as a OTC, that is over the counter, so you will miss. So I advise that please ask the history of pills, the OCP over here. So 4 P's: periods, pregnancy, complications in previous pregnancies, and pills. So, Dr. Naseem Al Huda, are you with me?
Yes, yes. It's clear now.
Now, try to take the insight into his or her life. Again, some questions are personal, some are not personal. Smoking is not personal question. Alcohol is not personal question. But of course, the usage of recreational or illicit drugs should be asked very sensitively. Sir, what do you do for a living? Now here is again a mnemonic, and my students who are already doing the July course, they know well these mnemonics. The mnemonic over here is Sajid T. Sajid T. Sajid is the male name. It's a common name over here in Southeast Asia. Sajid T. T mean, you can say the tea, black tea or any tea. T, just a T, a capital T. So what is Sajid T? S for smoking, A for alcohol, J for job, I for illicit drugs, D for driving, T for travel. So I will come back to them. If he is having something linked to hobbies, you can ask, like, what are your hobbies? Like asthma, like asthmatic patients. And of course, these questions are relevant. The questions of pets are relevant if the patient is having asthma. So, in all the history taking stations, you will do Sajid T. Sajid T. Your brother Sajid T. He loves tea. Sajid T. What you will do? S for smoking, A for alcohol, J for job, I for illicit drug, D for driving, T for traveling. But in the case of asthma, you can ask some other questions also, like any specific hobbies, any pets or animals in the home, and any recent changes in your home or surroundings. Like maybe there is some renovation going on in the home, maybe some renovation going on outside in the street. Okay, and sometime if you have time, you can go for the cage questionnaire of the alcohol. I hope you all know it. I will not go into detail of the cage questionnaire. And of course, regarding the travel, this is extremely important now. So the patient went to Africa 6 months back and symptoms started 6 months back. So I will ask, sir, did you completed your vaccinations? Where did you stay? Maybe he's staying in a five-star hotel. Maybe he's staying on the street. Sir, which sort of water you are taking? Maybe he's taking tap water over there. Maybe he's taking mineral water over there. Sir, did you did any camping over there? Any visit to lakes over there? So, of course, it will rule out giardiasis. It will rule out any fungal infections. So, a few questions are important in travel. Completion of vaccination, where was the stay, which water he used, any recreational activities, any visit to lakes, and any campings, and of course any activities like any casual partners. So this is extremely important in the case of travel. Now, You had completed your whole history. Now it is the time for systemic review. Till here, if you have taken a good history, in the 80% of cases, you will reach the diagnosis. But in some cases in which the diagnosis is difficult or it is involving multiple organs, sometimes you need difficulty. Why I have put systemic review in the end? Because now you can modify systemic review according to the time left. If you have time, if you have ample time, you can ask a lot of questions in these symptoms, in these systems. But if you have less time, you can modify according to your need. Now, what's the grave mistake which candidates make? They do systemic review in the middle of the history taking. And it is such a grave mistake that in the end, they are left with the family history, they are left with the social history, they are left with the concerns. And they cut their whole marks in station 2 because you are not at home. You are in examination hall and you are being observed by two examiners, and there is time pressure, the exam pressure. So I advise you that please keep systemic review in the end so that you can modify according to your needs. You had completed your whole history. Now, if you have time, ask 4 questions of neurology. If you have less time, ask 2 questions of neurology, 2 of cardio, 2 of respiratory. So you can modify it. So always do systemic review in the end, and you are doing this systemic review to rule in or rule out some diagnosis in your differential list. But if you're doing it in the middle, I am I fear that you can left with some history in the end. You will run out of time. So do it in the end. So how you will do systemic review? Ask 2 or 3 questions of each system, which are very important questions. Say I'm giving just example. In the GI, of course, abdominal pain is a chief complaint. Ask about it. Ask about any altered bowel habits, any jaundice, any vomiting. It will be enough. In the genitourinary system, any changes in your waterworks, any passage of stone, any blood in the waterworks. Enough. In the respiratory system, ask about any shortness of breath, any chest pain, any cough. Enough. In the cardiology, ask about any racing and pacing of heart, any shortness of breath while you go into bed or lie flat, or you need to take extra pillows, any pedal edema. So 2 or 3 questions are enough, and you with the experience, inshallah, you will come to know that which questions are important. Like these questions, which I had just told you, will screen all of your system. My question of GI will screen whole of my GI system. My question of respiratory system will screen whole of my respiratory system. So you will do like that. Dr. Naseem, am I clear?
Yes, doctor.
I think you all are awake or sleeping. I hope everybody is awake, right? Good.
Yes.
Okay, so I'm ending the presentation. I know it went so long and a lot of people will be boring, so I'm just ending it. So endings should be gentle. Now you have done your systemic review. Endings should be gentle. I will apply the ice. I will apply the ice. How? Now, before applying the ice, I will summarize. I will not just summarize for the patient, but for my examiners. Why? Examiners are taking the Viva examination since morning. They are also human beings. They are tired. Maybe they are not concentrating that much because of the overburden. So, sir, Mr. Naseem, you told me that you are having shortness of breath with cough, with sputum, having family history of CA colon or whatever, and you are smoker. So you will summarize. Your examiners will be listening to your summary. And in the end, I will say, Mr. Naseem, if I had missed anything, please do let me know. Please add anything if I am missing in this summary. So, if I am missing anything in the summary, surrogate will surely add. If he is not adding, if he is not adding, but examiners had told him to, like in the scenario, it was mentioned that you must tell to your candidate that you are having family history of cancer, but surrogate has forgotten to tell you, and he is not even telling you in the summary. So you are telling to examiner, sir, see, there is no family history of CA lung. So your examiner will consider that surrogate has forgotten to tell this thing. They will consider. They will consider when you are making your differentials. So summarize yourself. Summarize your history taking for not for your patient but also for examiners, so that they should know that you had been provided with this and this information by your surrogate. In the end, you will apply the ice. Apply the ice. Apply the ice. Don't forget the ice. What is ice? Idea. So what's your idea is? What's your problem is? What do you think what's the problem is? Maybe he is having simple asthma and he is thinking that I am having CA lung. So try to explore what his idea is, what he thinks that what's the problem is. After that, ask, so what are your concerns? He will say that, doctor, can I drive? Doctor, can I, will you admit me in the hospital or not? Doctor, I do not want to get admitted in the hospital. So try to uh, check all the concerns, ask all the concerns, and manage all the concerns. I tell to all my students that you will get no marks on asking the concerns. There are no marks for asking the concerns. Marks are for managing the concerns. If you are asked the concerns, you will not get any marks. Rather, you should manage them. If the patient is saying that, sir, I can't stay in this hospital, you will ask why. He will say, I don't like the food over here. So you should manage this problem. Sir, I have the marriage ceremony of my daughter just tomorrow. So you should manage this concern. Sir, I want to meet my family in the hospital. So you should manage this concern. So you will get marks of managing the concern, not just asking the concern. And in the end, I will do E, ice, the E of the ice, that is explanation. I will explain, sir, you are having this and this problem. I gonna treat you on the OPD basis, or I gonna admit you in a hospital, and I will run these and these tests, and I will formulate a team consisting of this and this doctor, and we will manage you in these aspects. So this is extremely important. ICE, idea, concerns, explanation. And when your examiner says to you 2 minutes from now, now you are supposed to start ICE. You should run towards the ICE because 2 minutes are at least you need 2 minutes to go for the ICE because C, the IC concern has the 4 marks. If you are not managing the concerns, you will miss these 4 marks. So I had completed my presentation and I hope you guys had understood it very well. So I am now opening the mics, and if there are any questions, do let me know. All the mics has been unmuted now.
Hello, sir.
Yes.
Hello, salam alaikum, sir. Sir,
Walaikum salam.
could you repeat the family history part?
Sorry, please
The
mute your
family history.
mics. If somebody do not want to ask any questions, I request you to please mute the mics. Please mute the mics. So now ask the question, please. Hello, please repeat your question. If anybody wants to ask the question, use the raise hand option, please. use the raise hand option if you want to ask something. Dr. Madhu, I had unmuted you. Go ahead, please.
Yes, sir. Sir, could you please repeat the family history part once? Because the questions how to ask the family history.
So, in the family history, I will ask similar problems or the similar condition in any family members, any disease or any illness which runs in your family, any history of sudden cardiac death, or any family history of cancers. Is it okay? Is it clear?
Yes, sir. Yes, sir. Thank you.
Dr. Samsona, want to ask something? Please go ahead.
Sir, the
Yes.
patient giving multiple complaints, like when we are talking the history, then one patient's telling, starting with like, for example, chest pain. And we are doing Odipara for chest pain, and we are while talking to, again, he's telling shortness of breath. And we are, do we want to take Odipara again for shortness of breath? Or he's giving you, for example, 4 positive finding. For all 4, we have to Odipara for that? Or just
See, in the PACES exam, as far as the PACES is concerned, you will be given a very concise history, maybe 1 or 2 symptoms. A very, a proper history. So, whichever complaints are, you will of course evaluate those complaints accordingly. Any other questions?
Okay,
If somebody wants to ask the question, use the raise hand option. Dr. Hatem, you want to ask something? Go ahead, please.
Yes, yes. Assalamu alaikum.
Walaikum assalam, Dr. Hatem.
Here, you advise us to left the systemic review to the end.
Yes.
But too many diagnosis has systemic manifestation like IBD, rheumatoid, SLE. I'm afraid if I left it to the end, I will lose too many findings.
If I am suspecting IBD in my case, I will ask all the extraintestinal manifestation when I am evaluating the complaint. I had mentioned over here that evaluate it more. Over here in the start. Systemic review is just your backbone, just your safe side. Just you can say just on the safe side that you are not missing anything. Otherwise, your history should be completed without systemic review. In case, if you want to do systemic review in the middle, what happens is that if you are missing systemic review, but you had made your diagnosis, no marks will be given. But if you have not completed your history, you had made the diagnosis, but you had not taken the family history or social history or had not asked the concerns, you will lose your lot of marks.
And also, and during our practice, we find sometimes diagnosis hide in the systemic review. Yeah, we ask the main concern and we go with detail.
Of course, you
still,
are. Yeah. I'm getting you. But again, you are of course giving time to systemic review in the end. You are doing whole of system. I am not saying that don't do systemic review. I'm not saying that skip it. Of course, do it, but try to do in the end so that if you are missing it, you don't detect any marks.
Okay, thank you very much.
Welcome. Any other questions? Okay, so I think there are no more questions. We are heading toward our the session that is our July course, and you guys can listen to our 2 histories and see how our active participants gonna do the scenario. So Dr. Ratna, want to ask something? Dr. Ratna?
No, sir.
Yes. You want to ask something?
No, sir. I just raised. It's my turn, so I raised to know you.
Okay, so it's your turn to perform today?
Yes, I exchanged with one of the doctors I messaged.
Okay. So it's your turn for the station 2. That's great. So I am muting all the mics and then we are starting our scenario. Dr. Ratna, please use the raise hand option so that I can unmute you. That's great. Dr. Ratna, please unmute yourself. So,
Yes,
Dr.
sir.
Ratna, I am providing you the screen, and as soon as you see the screen, please do let me know. So we'll start
sir.
our session. Okay.
Yes, sir.
So I'm sharing the screen for you guys. Here is my screen. Are you able to see the screen?
Yes, sir.
Okay, that's great. So here is the scenario for you. Just a second, please. This is the scenario. Take your 5 minutes and we'll start.
Yes, sir.
Dr. Ratna, are you ready?
Yes, sir.
Okay. Just a second, please. I am giving you time. I will prompt you at 12th minute and you have total of 14 minutes. Okay.
Yes, sir.
So Dr. Ratna, your time starts now.
Hello.
Hello.
Good morning.
Good morning.
Myself, Dr. Ratna, one of the doctor in the clinic today. Can I confirm that you are Mr. Ina and you are 62-year-old?
Yes.
Mr. Inam, today we are here to discuss regarding your health condition. While speaking with you, I'll make few notes that will be highly confidential. But be sure that while taking the history, I'll give while making the notes. Be sure that I'll be giving full attention to you. Is it okay with you?
Okay.
Mr. Inam, I've come to know that you have back pain. Can I say something more about it in your own words?
Yes, doctor, I'm having this nagging back pain. And it has disturbed me a lot. And it's quite severe pain.
Mr. Inam, Are you comfortable to speak with me now? If the pain is severe, I can give you some painkillers if you
Doctor, I
want.
need painkiller. It's quite severe pain.
Okay, I'll ask the nursing staff to give you painkiller. Is it okay?
Okay,
Okay, shall I continue?
of course.
Mr. Inam, can I know from when you are having this back pain?
Doctor, I'm having this bad back pain, I think, for the last maybe 2 days now.
Is this the first episode or previously also you had a similar episode?
The first episode.
Was it sudden in onset or
Sorry?
gradual in onset? How did the pain start? Was it in sudden or it was slowly it started?
It was sudden, doctor. It was absolutely sudden. And I don't know what has happened, but it started all of the sudden.
Mr. Inam, is the pain coming and going or present continuously since last 2 days?
It's continuous.
Okay. Do you think the pain is increasing or it is the same?
Of course, the pain is increasing.
Okay. Have you noticed anything which makes the pain worse, like taking rest or while you're working or doing
Even
some
a
activity?
slight movement is worsening my pain.
Okay. Mr. Inam, have you noticed anything which is reducing the pain, like taking any painkillers has helped you or
Yeah,
giving some?
yeah, painkillers are bit improving my pain, but it's just a temporary relief.
Okay. Is this pain going anywhere else? Like, is this where exactly is the pain in your back? Like in the upper back or in the middle or in the lower back?
So patient is touching the lower back region.
Okay. Mr. Inam, is this pain going anywhere else? Like, have you noticed that its pain is going anywhere else to your legs?
Yes, this pain is going in my right leg.
Okay. Okay. Is the pain shooting in nature? How is the pain? Like, is it dull ache, sharp pain, or is shooting in nature? How is it?
It's like a shooting current pain, like a current. I feel like a current traveling in my leg.
Okay. I shall to know this, Mr. Inam. Um, mm, mm, anywhere else in your body are having the similar kind of pain? Have you noticed?
No,
Okay. Along with this pain, are you having any problem in walking, or have you noticed any weakness in your limbs?
no, but yeah,
Okay.
I
Are you
can't
having any?
walk.
Okay, because of the pain, or are you finding difficulty in getting up from sitting position?
I am because of the pain. I am unable to.
Okay. Mr. Inam, are you having any problem while passing your water work?
No,
Are you having any problem in passing your back passage?
no,
Okay. Mr. Nirma, I'll ask you a few more questions. Is it okay?
of course.
Are you having any raised body temperature?
No,
Um, any night sweats?
no,
Any recent weight changes?
no,
Are you feeling any fatigue,
no,
tired? Okay.
no,
Any joint pains anywhere else in your body?
no.
Is this back pain more in the morning or more in the evening? Have you noticed?
Doctor, it's continuous pain. Like it's not getting relief. How I can tell that whether it's more in the morning or in the evening.
Okay. Do you feel any tightness when you get up in the morning? Like you feel any stiffness when you get up in the morning?
No,
Hello.
no, doctor, no,
Okay. Are you having any rash anywhere else in your body? Are you having any rash?
no,
Recent change in your skin color?
no,
Hello.
no.
Okay. How is your appetite?
Appetite is normal.
How is your sleep? Is this pain disturbing your sleep at night?
Absolutely disturbing my sleep, doctor. I'm unable to get a sound sleep since morning.
Mr. Inam, sorry to know this, but assure that we are here to help you regarding this.
Okay.
Can I continue?
Yes, for sure.
Are you having any, have you noticed any lumps or bumps anywhere in your body?
No.
Okay. Mr. Inam, can I ask you a few more questions? Is it okay?
Absolutely okay, doctor. Go ahead, please.
Were you diagnosed with any other medical conditions in the past?
Yes, I has been diagnosed with a case of osteoporosis, and I think it's been 2 years now.
Okay. Were you on any medications for this?
No, they have provided me with some vitamin D supplements and some calcium supplements. That's it.
Okay. Are you regularly taking these medications?
Yeah, I'm taking.
Mr. Inam, have you noticed have you noticed any trauma to your back? Like you sustained any trauma or injury
No,
recent?
no.
Okay. Are you regular with your vitamin D and calcium medications?
Yes,
Okay. Any other medical conditions you're suffering from?
yes. I'm having diabetes.
Okay. Since when you're having diabetes?
I'm having this diabetes now. It's an old story. It's been 10 years that I'm having diabetes.
Are you regular with your medication? Can I know what are the medications you're on for your diabetes?
Basically, nowadays I'm taking insulin for my diabetes.
Are you regular with your medications?
Yeah, absolutely. I'm regular with insulin.
Any recent change in your dose of the medications?
No,
Are you having any low sugar episodes or any other side effects? Have you noticed?
no,
Okay. Are you regular with your regular follow up with your GP for the diabetes?
yes.
Can I know your 3 months average blood sugar?
It was, I think,
Based on-
6.6.
Okay. Are you regular with your eye and food clinic follow-ups?
Yes, of course. Good, Dr. Ratna. Good. Good history.
Okay. Okay. Mr. Imam, are you suffering from any high blood pressure in the past?
No,
Any high cholesterol problem?
no,
Any past surgical history?
no,
Any past dental procedure
no,
or hospitalization for any issues?
no,
Okay. Past history of any blood transfusion,
no,
tattooing?
no.
Are you allergic to any particular food or medications?
Peanuts. I'm allergic to peanuts.
Okay. 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 Mr. Any of the family members suffering from any of the medical illnesses?
Mhm. Sorry, please ask again.
Any of the family members suffering from any other medical illnesses?
Yes, my dad was having diabetes, and also my mother was also having diabetes. Otherwise, there's no family history relevant.
Sorry. Anyway, sorry to ask you, any history of sudden cardiac death in the family?
No,
Any history of cancers in the family?
no,
Okay. I'll ask you a few more questions. Is it okay?
of course, okay.
Can I know with whom you're living?
I'm living with my wife.
Okay. Are you having any kids?
No,
Sorry to ask you, this will be a highly personal question. Please don't mind, and we ask this question for all our patients. Are you having any casual partners also?
no.
Okay. What do you do for your living?
I'm a truck driver.
Okay. This problem must be affecting you, is it?
Of course, I'm unable to drive my truck for the last 2 days.
Mr. Mr. Inam, if you, as you're having problem in driving the truck, okay, we can involve our occupational worker who can help you in this regard. Is it okay?
Absolutely okay.
Do you smoke?
Yes, 2 cigarettes per day for last 10 years.
Okay. Mr. Inam, any amount of cigarette smoking is not good for health, as cigarette smoking leads to uh, mm, many problems, I will refer you to our smoking cessation clinic. Is it okay?
Absolutely okay.
Do you consume alcohol?
No,
Sorry to ask you this personal question. Is there any history of any illicit drug usage or party
no,
drugs? Okay. Is there any history of any recent travel?
no.
Okay. You said you drive truck for your living, right?
Yes,
Do you have enough financial support?
yes,
Okay. Do you have any specific hobbies or any
no.
interest? Okay. I'll ask you a few more questions. Is it okay?
Absolutely okay, doctor. Go ahead.
Okay. Okay. Are you having any headache?
No,
Any problem with your vision?
no,
Any blurring of vision?
no,
Any diminution of vision?
no,
Any weakness in any part of your body?
no,
Any shakiness or any loss of consciousness?
no,
Okay. Are you having any mm, sores in your mouth?
no,
Any nasal discharge?
no,
Any difficulty in swallowing?
no,
Any metallic taste in your mouth?
no,
Any early satiety?
no.
Any
What is
tummy
early
discomfort?
satiety? I'm not a
Early
doctor. I'm a
feeling?
poor truck driver.
Sorry, Mr. Inam.
Inam?
Are you feeling easy fullness after
No,
initiating your food? Okay. Any tummy discomfort are you having?
no,
Any problem with your back passage? Like, are you
no,
having any hard stools? Any blood in your stools?
no. 2 minutes from
Uh,
now.
okay. Any dark color stool?
No, 2 minutes from now.
Okay. Okay. Are you having any? Okay. Okay. Any shortness of breath?
No,
Any chest pain?
no,
Any cough?
no,
Any hemoptysis? Any blood in
no,
your phlegm? Okay.
no.
How is your mood?
Mood is just, I'm sad because of this pain. Otherwise,
Okay.
I'm okay.
Okay. Okay. Any swelling in the neck?
No,
Okay. Okay. Mr. Mm, Mr. Inam, can I know what are your concerns?
my concern is, doctor, why this pain started so suddenly? Like it started all of the sudden. And it's so much like severe pain that it's going in the leg. And I feel
Um,
that something is cutting in my back. Something is getting cut in my back. What it can be?
Mr. Inam, your back pain uh, is because probably you have sustained a fracture of one of the bones of your back. Okay, what we call it as a osteoporotic fracture. Okay, I'm sorry to say this. Okay, we need to run few investigations and imaging. Okay, to confirm the diagnosis. Once the reports are available, you will be seen by our multidisciplinary team. Okay, and we'll have one more meeting to discuss the plan of management. Is it okay?
Okay.
You have
Okay.
any other concerns for me?
No concerns. And your time is up. You have
Okay,
1 minute for reflection, then your Viva will start.
okay, sir.
Okay, Dr. Ratna.
Yes, sir.
So can you please summarize your case for us?
Mr. Inam, who is a 62-year-old male patient, he has come with a history of sudden onset of back pain of 2 days duration.
Go ahead.
With radiating pain to his right leg.
Go
with
ahead.
the past history of diabetes and osteoporosis on calcium and vitamin D supplements. With this history, my first diagnosis is osteoporotic fracture leading to compression of the nerve root leading to right leg radiculopathy.
This patient is having a very sudden pain, What he was doing at that time? So you need to ask if there is some symptom that is sudden. Try to ask what you were doing at that time. I was doing a weightlifting. I was driving a truck. I was sleeping. I was making tea. So it's relevant. Okay. This patient was driving a truck. He got a jump and he started having pain. So one of your differential is osteoporotic fracture. Any other differentials?
Any sudden lumbosacral disc herniation because of sudden jump leading to nerve compression.
Good. Okay. So, what do you think in these two diagnoses, which will be on top?
Sir, I'll go with lumbosacral disc herniation with radiculopathy.
Good. Considering your case, how you will evaluate your case?
We'll be getting then
and give reasoning of your each investigation.
Yes, sir. We'll be getting then a complete blood examination to know if the patient is having any anemia. And we'll be getting then his fasting blood sugar, postprandial blood sugar, and his 3 months average blood sugar HbA1c. As he is having long-term diabetes, we want to know his renal function, so we'll be getting the renal function test along with the electrolytes.
Good.
And we'll be getting the urine complete examination. We'll be getting that.
Good.
We'll be going for his as there is a history of osteoporosis in the past, we'll be repeating his vitamin D level and calcium level.
Good.
And we'll be getting that his MRI as he is having compressive symptoms. We'll be going for MRI of the spine, lumbosacral spine.
Okay. So suppose this patient is having disc herniation. So yes, now disc herniation is in front of you. How will you manage this patient?
Okay, sir. The patient will be seen by our multidisciplinary team, including our consultant physician, specialty nurse, and orthopedician. Will be educating the patient regarding the condition.
Spine surgeon, neurosurgeon.
Spine surgeon. Yes, sir.
Good.
The spine surgeon, neurosurgeon will involve, and the patient will be educated regarding the condition. Okay, will be advised complete test, physiotherapy, and we'll be starting him on NSAIDs, painkillers, mainly NSAIDs will initiate. Depending on the severity of the compression, whether any neurosurgical intervention is there, will be planned.
So, and there is a last question to give you full marks. Can you name the procedures which can be performed for this herniation?
Sir, any discectomy, sir, or?
Good. Micro discectomy, or laser discectomy. So, Dr. Ratna, this was a masterpiece by you, and if I am your examiner, I will give you 20 out of 20. Thanks to you. Thank you so much for taking such a good history. It was really a superb history of the back pain. and superb, you know, and the way you carried out this case and your approach. And I really appreciate the way you have done this case. So if I'm your examiner, I would give you 20 out of 20. But
Thank you.
yeah,
Thank you.
there are few messages for you. If there is
Yes, sir.
something sudden, something sudden, ask what the patient was doing at that time, what he
Yes, sir.
was doing. Okay.
Yes, sir.
Otherwise, your history was adequate, and I am happy with your performance. And
Yes, sir. Thank
regarding
you.
the feedback, I don't think so that this case need any feedback, because almost all of the case has been done by Dr. Ratna. But yeah, it was the case of disc herniation, and of course it is usually sudden, and in this case it has happened after the jump, and he was driving the truck. He was also already osteoporotic, which led to the compression of the lumbar nerve, and now he is having a shooting pain in the leg. It is like a current sensations in the leg, and of course you need to take a proper history of the back pain. You need to take the history of any loss of loss of bowel or bladder functions, any foot drop, any numbness, any tingling. Of course, you need to all this stuff. And of course, to rule out your other differentials, you will ask about the fever. You will ask about if there is any source of infection or anything like that to rule out osteomyelitis. And yeah, after taking the detailed medical history of this patient, you will run some tests. You need a new vitamin D levels, calcium levels, DEXA scan if required, and you need proper imaging. You need to look for any deformity in vertebra. You need to look for any lumbar disc herniations, and if you are suspecting any viral any infective cause, you can go for ESR and CRP and total leukocyte count. And of course, management will be according to the cause. If it is a vertebral fracture, you need to fix it. But if it is lumbar disc herniation, you need a procedure. But you always not go for the procedure, and you mostly go for the procedure if there are bowel or bladder dysfunction, and you go for the procedure if there is some motor deficit. Otherwise, you manage such patients conservatively by rest. You give them muscle relaxants, you give them NSAIDs, you give them gabaline or pregabalin. And if the patient is still not responding, you can go for discectomy. It can be lumbar discectomy, it can be hemilaminectomy, it can be microdiscectomy, it can be laser discectomy. It was all about this case. So I am unmuting the mic. If there are any questions, I will take the questions. Otherwise, we will proceed to our second scenario. All the mics has been unmuted now. Yes, Dr. Simpsona, you want to ask something?
Yes, sir. In this scenario, patient already diagnosed with osteoporosis. So do we want to go into detail about what is the risk factor related to this osteoporosis, any cause for it?
Yeah, you can ask by asking the medication history, but yeah, age is itself a risk factor over here. So in this case, your task is to evaluate. Now, this patient has presented to you with back pain. Now, what's the cause of this back pain? There are a lot of causes of the back pain, and you need to diagnose it on the basis of your history. This is your primary task.
Okay, sir.
Any other questions? Okay, so I think there are no questions. So we are moving ahead with our second case. And let me check who is our second participant. And our second participant for today is Dr. Humera. Dr. Humera, are you online? Dr. Humaira, please unmute yourself.
Yes, sir. Assalamu alaikum.
Walaikum assalam. How are you, Dr. Humaira?
Fine, alhamdulillah.
That's great. So we are heading toward our second scenario. Dr. Humaira, are you able to see my screen?
Not yet, sir.
Now,
No,
is it clear?
it's not
Still,
shared.
are you
No,
unable to see?
it has started sharing.
What about now?
Sharing, sir.
What about now?
Still. Now,
Yeah.
yes, sir.
Your voice is not clear,
Okay,
Dr.
sir.
Humaira.
I can see.
Okay.
Can
Take
you
your
hear me
time.
now?
Yes, please take your time. Dr. Humaira, are you ready? Hello.
Yes, sir.
Okay.
Yes, sir. I'm ready.
Dr. Humaira, please try to see your mic. There's some problem in your mic. Maybe some problem in your connection. Okay, let's start. Let's see how it went. Okay, your time starts now.
Good morning.
Good morning.
Hello.
Hello.
I'm Dr. Hani, doctor in the clinic. May I confirm? May I confirm you are Mr. Shahid and you are 33 years old?
Yes, I am Mr. Shahid. I'm 33 years old.
Nice to meet you, Mr. Shahid.
Nice to meet you.
Today I'm here to talk about your health problem.
Let
and while
me
I'm going to putting down some notes.
let me answer the first question. I have just seen the chat box. Osteoporosis is quite common in the elderly age. But yeah, if it is occurring in the young age, you should evaluate it. You should go for testosterone testing. You should go for other causes of hypogonadism. But in the age that is above 60 or 65, you should consider it as a normal aging process. Of course, it is quite common in females, but it is not less common in males. So just focus on the scenario, try to diagnose the cause of the backache. But yeah, if osteoporosis is occurring in the young age, that is less than 50, and especially in the males, of course, you need to look for hypogonadism. Otherwise, don't complex this scenario for yourself. Focus on your task and go ahead. Now, Dr. Humera, please restart your scenario.
Hello,
Hello.
I'm Dr. Hanif, one of the doctor in the clinic. May I confirm you are Mr. Shahid and you are 33 years old?
I am Mr. Shahid and I am 33 years old.
Well, nice to meet you, Mr. Shahid.
Nice to meet you.
Right. Today we are here to talk about your health problem, and while talking to you, I'm going to put down some notes, which is going to be confidential. Okay with you?
Absolutely okay.
Well, Mr. Shahid, as I can see from your GP notes that you're suffering from some problem related to your weight and also problem with your heart stools. So first of all, we'll talk about your weight gain. Could you please tell me more about it?
Yes, doctor. I had gained, I think, 10 pounds of weight over 3 months. It's increasing.
Okay, right. So is this? I assume this is unintentional, Mr. Shahid, or is there
Yes,
any
it's
recent change in
unintentional.
your appetite?
No, it's unintentional.
Right, and your appetite is same through this period,
Yes.
even before?
Yes, my
Right,
appetite is
or
same.
any change in your physical activity, Mr. Shahid?
No change in physical activity, but yeah, you can say nowadays I am eating more.
Right, so we can say that your appetite has increased, right?
Bit increased.
Right. Mhm. Okay, right. Is there any particular area where you have gained weight around,
No,
for
overall,
example,
it's
your tummy, or
overall,
is it
it's
generalized?
overall.
It's overall, right. And along with this weight gain, have you noticed that uh, your any change in the size of your shoe or ring, like any increase
No,
in the shoe size or your ring size?
no,
Okay, right, right. And have you noticed that do you have any weather preference?
no weather preference.
Okay. Any joint pain or any rash anywhere in your body?
I don't have joint pains, but I do have this constipation thing.
Okay, right. So what can you tell me more about it? What do you exactly mean by constipation?
Yes, I
Is it the
have basically.
frequency or
Yeah, yeah. I'm telling doctor. I pass my stools and I pass after about 3 days, and they are quite hard.
Mhm,
And I often have also the tummy pain.
right. So may I ask what is your usual bowel habit?
Yeah, bowel habits are very fine, but nowadays I'm having
Right.
constipation for last three
Mhm.
months.
So it is the frequency which has changed, and also you're
Yes,
passing hard stools, if I'm not
yes,
wrong. Okay. Have you noticed any blood in your stools?
no,
Okay. And when during your bowel movement, have you noticed any pain or any on passing motions?
No pain, but yeah, of
Mhm.
course, when I pass the hard stools, I do feel some difficulty. But yeah, I do have pain in
Right.
my tummy.
You have pain in your tummy. Right, right. And where exactly, Mr. Shahid? Can
It's all
you?
over my tummy.
Okay, right. And how about your waterworks, Mr. Shahid? Have you noticed any
Water.
change in the color or amount?
No.
Okay. Have you ever passed stones in your
Yes,
waterworks?
doctor. How do you know it? I passed stones twice.
Right. And when was that, Mr.
I
Shahid?
think about 2 months back.
Okay, right. And okay, apart from this tummy pain and passing stones, have you ever felt sick or actually you threw up?
No.
Mm-hmm. Okay, and how's your mood otherwise, Mr. Shahid? Have you noticed any
Mood is low nowadays. I feel depression.
you feel depressed? Okay, if you don't mind, may I ask you, is there any particular reason behind it? Could
No
you
reason, but
figure
I
out
don't know.
what could be the reason?
Always my mood stay low.
Okay, right. Any other thing you want to add here apart from these symptoms?
Like what?
Anything, for example, okay, right. Okay, don't worry. We will, okay, Mr. Shah, I would like to ask some questions related to your past
Dr. Humera, your voice is not
health.
clear. It's getting break.
Is
It's
that all
getting
right?
break. Your voice is getting break.
Sir, can you hear me now?
Yes, we
Hello?
are able to listen to you, but voice is getting break in between.
Sir, okay. Sir, if you can pause, I will switch my internet.
Yes, I can pause. Please switch it. No problem.
Yeah, I will let you know. I'm hello.
Yes, go ahead, Dr.
Can,
Humera.
yes, sir. Can you hear me now? You can start, sir.
Yes, yes.
Okay.
Timer is started again.
Right. Okay. So, so apart from this tummy pain, have you noticed any burning sensation in your tummy or in upper part of your
No,
chest,
I don't have any burning sensation in my tummy.
or any metallic taste in your mouth?
No.
Right. Have you ever suffered from any disease spells?
Yes, I do have disease spells, doctor, and I has been diagnosed as having some hypoglycemia, low sugars.
Mm-hmm. Right. And when was that, Mr. Shahid?
I'm getting these spells for the last 6 months.
I'm sorry to hear that. Don't worry, we are here to help you.
Thank you.
Okay. Mr. Shahid, have you noticed any headaches?
Yes, doctor, I do have headaches, and they are bothering me a lot.
Mm-hmm. Any change in your vision?
Yes, doctor, there is some problem in the vision also.
Mm-hmm. Okay, right. And okay. Okay, so Mr. Shahid, I would like to ask some question related to your
What
past
is
health.
the problem
Is there
with
any?
your vision, Mr. Shahid? Ask him the
Mhm.
problem. Why you are not
Okay,
asking
right.
the problem?
Can you explain me more? What exactly is the problem in your vision?
I bump into objects. I bump into objects.
Right, right. And do you drive, Mr. Shahid?
Yes, I do drive.
You
I
must be
drive a
finding it
sports car.
difficult. So you
Yes, of
must be finding it
course.
difficult on seeing the
Recently, I
signboards.
bumped into tree.
Right. I will come to that. This is a very important point I have noted down regarding your driving. I'll talk about that in a while. Is that okay?
Absolutely okay.
Right. So, Mr. Shahid, do you suffer from any long-term illness in the past?
No,
Any raised blood sugar, raised blood pressure, any
no,
other illness? Have you ever been operated in the past?
no,
Okay. Any recent dental procedure?
no,
Any history of blood transfusion?
no.
Okay. Mr. Shahid, are you taking any medications? Are you on any regular medications?
I'm just taking multivitamins for my weakness. That's it. Otherwise, I am not taking any medications.
Right. And does these multivitamin contain calcium also?
I don't know. I'm not a doctor.
Right. Okay, right. Any other over-the-counter medication, Mr. Shahid?
No,
Any herbal remedies?
no,
Okay, right. Are you allergic to any medication or any food?
no,
Do you suffer from any skin allergy?
no.
Okay. Mr. Shahid, I want to ask some question related to your family. Is there any long-term illness that is running in your family?
I'm orphan.
Okay. Right, right. Okay. So, Mr. Shahid, may I know? I want to ask some question regarding related to your lifestyle. Is that okay?
Absolutely okay, doctor. Go ahead.
Do you smoke? Do you smoke, Mr. Shahid?
Yes, I smoke 10 cigarettes per day for last 5 years.
Right. Well, Mr. Shahid, as you know, that smoking has very deleterious effect on health. So I would like to refer you to the smoke cessation clinic. Is that okay with you?
Absolutely okay, doctor. I will
They can help
consider.
you in this regard. Okay. And how about alcohol?
I don't take alcohol.
Okay, right. And I'm sorry to ask this question. I ask this question to all of my patients. Do you take any illicit drugs,
No,
like party drugs?
no,
Okay, right. Okay, Mr. Shahid, have you traveled anywhere recently?
no.
Okay, right. Mr. Shahid, I want to ask some personal question. Is that okay?
It's absolutely okay, doctor. Go ahead.
Okay. Are you into any long-term relationship?
I'm married.
Right. And I'm sorry to ask another question. Any casual partners?
No.
Okay, right. Mr. Shahid, do you suffer from any problem in your intimate relationship?
Yes, I feel that I'm having less libido nowadays.
Okay, and since when you have noticed this thing?
Last 3 months.
Right, right. Okay, don't worry, Mr. Shahid. We are here to help you, and I will refer you to the concerned department. Okay,
Okay.
right. So, Mr. Shahid, I would like to ask some more questions related to your general health. Is that okay with you?
Absolutely okay, doctor.
Do you have any chest pain?
No,
Any shortness of breath?
no.
Are you able to lie down flat? Or do you need extra pillows?
Absolutely. No, I don't need any extra pillows.
Any cough?
No,
Okay. Any swelling in your feet or around your face?
no.
Okay, right. And you told me you don't suffer from any joint pains, right?
Yes.
Okay. And do you feel dizzy on getting up from sitting posture?
No,
Okay. Have you noticed any weakness or numbness in any part of your body?
no.
Okay, right. So now, Mr. Shahid, what do you do for your living?
I'm a fruit vendor.
Right. And okay, right. And are you financially well supported, Mr. Shahid?
Yes, I am financially well supported.
And you told me that you drive also, right?
Yes.
So, Mr. Shahid, here I would like you to, I would
2
like to advise
minutes
you that
from now.
kindly stop driving until your problem, you are diagnosed and your problem is solved, since you are suffering from some problem
Okay.
regarding your vision, right? And Mr. Shahid, before I tell you what could be the reason of your symptom, I want to check your idea. Is there anything in particular you are worried about? Do you have any idea what could be going on?
I feel that I am having cataract in my eyes.
Okay, right. Well, Mr. Shahid, let me tell you, I suspect that you are suffering from a condition which is called MEN syndrome. Don't be bothered about the terminology. Basically, what happens that in this condition, sometimes there are tumors in glands, and the function of gland is to produce hormones. So because of these tumors, these glands are producing excessive hormones, and that's why
Don't
you're having
say
these different
hormone. Hormone is a
proteins.
jargon.
Proteins.
Protein.
And because of these excessive amount of protein secreted by these glands, you're having this different manifestation of this disease. Okay.
Okay.
So what I'm going to do is that I'm going to refer you to the multidisciplinary team, which will include a gland doctor, a bowel doctor, and a surgeon, right?
Good. Okay.
So do you have any concern at the moment, Mr. Shahid?
Doctor, my concern is like why I am having this constipation, how it is linked to my condition.
Well, Mr. Shahid, basically, you know, there are in this condition we have, as I told you, this is related to your gland. So we have different glands at different places in our body. For instance, one of the gland lies in our neck, which is called parathyroid gland. The function of this gland is to secrete calcium, and in your condition, this calcium is secreted in excessive amount,
Okay, your
and
time is up,
that's.
and it was a superb history taking again. Dr. Humera, claps for you. You have 1 minute time for reflection, then we will start your viva.
Okay, sir.
Dr. Humera, are you ready?
Yes, sir.
Can you please tell the list of your differentials?
Sir, from outside, patient with
No,
weight gain.
no. Examiner is not asking you from out.
Right. Okay.
Examiner is asking you the list of differentials after hearing the case.
After hearing the case, my top differential is men syndrome because of these concentration of
Which
symptoms which
men?
he is having.
Which
Men
men?
one, men one, when
Good.
men one, because he is having the symptoms of hyperparathyroidism. He is having symptoms of pituitary adenoma, and also he's having hypoglycemia. So looks like he's having
For,
insulinoma.
for any other differentials you want to consider?
His TSH was normal, so my second differential could be hypothyroidism, constipation, and weight gain.
Okay. Good.
And since he was orphan, otherwise I would have asked if anyone is this some people they have family tendencies, so it could be familial also.
Considering it a case of men 1 syndrome, how you will evaluate your patient?
So I will start by evaluating hyperthyroidism by doing calcium and parathyroid hormone level.
Good.
And ultrasound of neck.
Good.
And for pituitary, I will check serum prolactin level, growth hormone levels, and MRI. Brain.
All the hormones, all the hormones, all the hormones, all the hormones. Good.
Right. And so for insulinoma, we will do supervised 72-hour fasting and CT MRI of his abdomen, CT or MRI of his abdomen.
For insulinoma, go for insulin levels, go for C-peptide levels,
Yes, sir.
go for CT, MRI, and often it's missed. So the newer investigation for insulinoma is endoscopic ultrasound. Endoscopic ultrasound.
Endoscopic.
Endoscopic
Okay, sir.
ultrasound.
Right.
Okay,
Right. Right.
good. So if this is the case of insulinoma, how you will manage the pancreatic insulinoma?
Sir, there are two options: surgical removal and somatostatin analog, which is octreotide.
Okay, ultimate option is
Surgical removal.
okay. And what are the options for hypercalcemia? How you will manage the case of hypercalcemia?
So subtotal or total parathyroidectomy with forearm autotransplantation.
Before that, hypercalcemia, how you will manage in your ward, hypercalcemia?
By hydrating the patient,
Good. Then,
not with normal saline,
then,
and I think
erythroid,
diuretics. Okay, right. Bisphosphonates, right, right.
good, 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 good. So, again, a very good history taking. I am so happy that both of my students had followed the scheme today after listening to this presentation. It was almost complete history taking, but there was some connection problems. We were unable to properly listen to you, but
Still,
I
sir,
will give you,
still I
no,
have
now
problem.
it's okay.
Okay, right,
And
right.
I will give you 20 out of 20.
Okay, thank you, sir.
Absolutely masterpiece by you and a good history take. But try to
Thank.
try to take history a bit faster. Don't think much.
Yes,
Don't
sir,
think
right.
much. And I really
Sir, because
appreciate
there was
the
your
way
voice was lagging, maybe because of my connection. So that's why.
and you modified the
Right.
history as you were getting more evidence. And this is a clear cut evidence for all of the participants of today's session that these both candidates has took systemic review in the end, and alhamdulillah they both reached the diagnosis. So feedback regarding the case.
Thank
This
you, sir.
patient was having Mensman syndrome as evident by bitemporal hemianopia, frontal headache, and decreased libido, and he was having hyperparathyroidism as evidenced by tummy pain, constipation, and of course he was having insulinoma as evidenced by hypoglycemia, attacks of dizziness, which improves by administration of glucose, and of course, he was having weight gain. It is a cardinal feature of insulinoma, and the ultimate management do depends upon the investigations. You need to evaluate for uh, for the pituitary hormones, pituitary tumor by going for the pituitary hormones. And of course, you will like to go for the MRI pituitary. And of course, the treatment is to give octreotide if there is evidence of some growth hormone secreting tumor. Otherwise, the ultimate management is the surgical resection, and you do take transfinidal approach to remove the tumor. If the patient is not a surgical candidate, you will go for irradiation. You will irradiate this tumor with the radiations. And for the hyperparathyroidism, you try to manage hypercalcemia by giving fluids, by giving bisphosphonates. If it is not managed, you can go for resection of parathyroid glands, that is called parathyroidectomy. And for the insulinoma, you need to localize the tumor. You need to localize the tumor by uh, venous sampling, or you can go for the EUS, endoscopic ultrasound, and of course you can go for the surgical resection to remove the tumor which is creating excess of hormones, the insulin hormone. This is all about Men's syndrome, its clinical presentation, its lab investigations, and its treatment option. Here we are stopping our session for all the guests, and we are extremely thankful to all of you for your participation. And now we will start from our regular session. Thanks to all of you. Thank you so much, and goodbye.